partners at the Association of Asian Pacific Community Health Organizations, APCHO. I wanted to thank you for joining today's webinar. My name is Kate Moraz. I'm the Senior Program Director at the Hepatitis B Foundation. Really excited to present today's session on strategies to work with your local policymakers on hepatitis B. So before we get into the webinar today, I'd like to review a few housekeeping items and let you know how you can participate in today's webinar. Please note that all attendees are in listen-only mode and you are muted during the presentations. There is also a phone-in option and the call-in numbers are shown here. And you may submit questions at any time during the presentations. Please type them in the question box on your GoToWebinar control panel. We will be reviewing them as they come in and will hold a question and answer period after the two presentations. And finally, today's webinar is being recorded, so we will provide a recording to share with you after via an email with the link and also a copy of today's presentations. So today we're going to be talking about local advocacy strategies and we have some great best practices to share with you. We'll start out by introducing our presenters. Our first speaker is Isha Weerasinghe. Isha is the Director of Policy and Advocacy at APCHO. Isha will be starting us off with an overview of engaging with local policymakers. And then our second speaker is Nikki Bannister. Nikki is a grant manager for the New Jersey, New York Hepatitis B Screening and Linkage to Care Project, and she is a former community chair of the New York City Hepatitis B Coalition. Nikki is a hepatitis B advocate for New York City, and she'll be sharing some local level best practices out of her work with the New York City Coalition. All right, and with that, I'm going to turn it over to Isha.
Thank you, Kate.
I'm going to move you.
Yeah, go ahead.
There you go.
Okay. Hi, everybody. This is Isha Weerasinghe, and as Kate said, I'm just going to be providing you all with some basics on how to work with your local and state policymakers to increase Hep B awareness. I know some of you have been with us in DC to do some national advocacy work, so we wanted to make sure that you had the tools, some of the tools that you needed to be able to do that same work in your local areas and within your states as well. So the first question is, why would you advocate on the local and state level? Why would you decide to bring this back home? And you all know that really the more people that we tell about hepatitis B and the importance of addressing hepatitis B, the better. The more policymakers at whatever level we tell about the importance of hepatitis B, the more that the general public is aware of the impact of Hep B on so many communities. So with that, by advocating on the local and state level, you're helping to build local champions, and Nikki's going to be talking about some great successes that have resulted from building local champions. And another thing that you could end up getting by doing this local advocacy is increasing funding for your organization and coalition, and of course, being able to rewrite or write policies and legislation that is better for your state or your city. So who are we talking about when we're talking about the players? So we're not, although we're coming from the DC spectrum, we're not only talking about your congressperson and your senator, although we highly, highly encourage you all to reach out to your district congressperson and senators' district offices. But we're also talking about, when we're talking about the local and state advocacy, we're talking about state Senate offices, state this is not an exhaustive list. You know, whoever you think would be able to have that ability to make changes in policies is who you should be talking to. So the next question is, how do you reach your policymaker? So one maybe obvious way is to look at the websites of these offices of your city, your policymakers. But there's another great tool here, which is this link, which I wanted to show you all just really quickly. So it's called Common Cause. And so if you put in your address, so I was putting in my office address, and it will tell you who your federal legislators are. And I live in DC, so we don't have any state legislators, but for you all, you'll be able to find out the website and so it will have obviously your federal legislators, but it'll also have your city legislators as well. So I thought that was a really helpful tool. The link to that is right there. So supposing you know how to reach your legislator, so what kinds of things could you do next? So some suggestions are to go and visit their office, of course, and schedule a meeting. You could invite them to an event that you're already hosting, but even if you're not having an event, you can plan a site visit. You can ask them to come and visit your organization or your clinic or your coalition, even a coalition meeting. So here's an example of one of our Hep United partners and APTA members, International Community Health Services, when during National Health Center Week, which is during August of this year, on the left there's a picture of Congressman Adam Smith, who is there. They have a very close relationship with their legislator. So the question is how, if you do not have a close relationship with your policymaker, how can you start to build that relationship? So one way is to write a letter to your policymaker's staff and scheduler if that person is a congressperson or a senator. And we're going to provide you with some examples in the handout section of this webinar. And if there try to see if you can schedule a time for them to visit or for you to visit them. And once you schedule that meeting with your policymaker, what do you do? Some of you may know this from your visits to DC, but it's important to really make sure that your meeting with your policymaker is somewhat structured, in that you include during the meeting you include an introduction of yourself and how you define the connection that you have with the area that you live in, and the more local that you're able to bring that to the policymaker, the better. And during the meeting, it's important to tell a story. Policymakers, legislators, they love hearing stories, whether it's your story or someone else's story. I've heard staffers on the Hill say, you know, as long as we hear a story, it doesn't have to be somebody that you're directly related to, as long as obviously it's related to the issue. That's what's most important, but you need to keep it brief. During the meeting, it's important to bring local statistics, and as I said, the more local you can make those statistics, the better. If you have an ask, let them know. So by an ask, we mean what is the purpose you're having the meeting for. So potential asks I put down here are having a policymaker participate in an event, or perhaps you're trying to get that policymaker to carve out some discretionary funding to provide hepatitis B services to your organization. Or maybe your ask is to just, it's an educational session and you really just want to let that policymaker know more about the impact of hepatitis B on the clients and patients. All of those are valid, all of those, as long as you have that ask in mind, it's very important to state that very explicitly in the meeting. During the meeting also, make sure to let the staffer or policymaker know that you can be a resource to them if they have questions about the hepatitis B or hepatitis C in the future. Let them know that you are their resource. Make sure to bring a business card and, if necessary, leave behind materials or provide electronic copies of those leave behinds when you follow up. And then, of course, also when you follow up, make sure to follow up, make sure to thank them. And then another tip is, while you have that, follow them on social media through Twitter or Facebook or Snapchat or Instagram, or the many ways that there are to connect with policymakers these days. That way they will connect your organization with the work that you do, because they have just seen you either during a site visit or when you've met with them. So now that is one of the basic ways to build a relationship with your policymaker, what are some other ways that you could build those relationships with policymakers in your area? One way is to visit a town hall. You could, we've heard examples of our partners going to town halls and asking very pertinent questions relevant to hepatitis B services, or the lack of services that are provided about hepatitis B. So that is the ways, that is a public forum in which you can really highlight the needs of your communities, or the communities that you serve. Another way is to, of course, build coalitions and find like-minded groups like the African immigrant communities, Hep C communities, African American communities, and immigrant communities as examples, and build an advocacy coalition. I came from New York before moving to DC, and we in New York City had an advocacy coalition with Hep B and Hep C advocates together to work on how we would approach the mayor's office and the city council as well. And sometimes that can be really effective, and then the results from that advocacy coalition help to feed into our city coalition as well. So supposing you know your local policymakers and you have really good relationships with them, so now what? You can work with them. Some ideas are to work with them to write a proclamation on viral hepatitis or hepatitis B during a significant day, for example, National Hepatitis Testing Day, which is on May 19th, or perhaps during Asian Pacific American Heritage Month in May, or another important month. There are so many or days throughout the year. One thing that I would programs every year. So you could, by looking at the calendar, you then know when you can apply for that funding. One tip would be to find partners who work with the calendar regularly, who can help you with advocacy efforts, and perhaps work to include your ask within their asks as well. Knowing the city and state budget calendar, or the calendar in general, will also help you to know when the policymaker is around. So you can perhaps plan events around when they are around, or just know when they're available to visit your organization or coalition. So that's those are a few tips I have for you all, and I'll leave the questions, as Kate said, to the end of after Nikki presents. But that is my email address, and then I'll pass it on to Nikki.
Great. Thanks so much, Isha. All right. So now we're going to turn to looking at some strategies from New York City. So I'm going to turn it over to Nikki Bannister.
Hi, my name is Nikki. I'll be speaking about the best practices from New York City's Hepatitis B advocacy initiative. A little background about me. From 2013 to 2015, I was the Hep B program coordinator at Charles B. Wong Community Health Center in New York City and the former community New York City Hepatitis B Coalition. Since then, I have moved to Portland, Oregon, and have since working on different programs, but I still can still involved in hepatitis B. So next slide. So in May 2020, hepatitis local law was enacted, requiring the Department of Health and Mental Hygiene to issue an annual report regarding hepatitis B and hepatitis C. And in this report, it would be required to provide information on such things as the number of new cases and the prevalence of Hep B and Hep C, demographic information, and so forth. This was really important, to elevate the status of hepatitis as a serious disease in New York City that was affecting a large community. It was also really beneficial to the local organizations to support grant applications, to understand the current situation, and then also to measure the impact made by initiatives by the local organizations. And with this legislation, there was significant funding made available to organizations to provide linkage to care programs. So it was a real big win for the advocates, but it was a long road to get here. Next slide. So this is a busy slide, but you can really get an idea of how much time it took. It took us over 4 years to get this legislation actually signed into law. And there were many events and many activities to make sure that this happened. You can see that the journey began January 2011. That's when the City Council member Margaret Chen proposed the legislation. However, it never made it onto the agenda with the Committee on Health. So time went on, and then February 2014, the legislation was introduced again. Margaret Chen has been a very important champion for hepatitis B, a longtime supporter. She really just understands the impact on Asian Americans and her constituents in Chinatown. So, next slide. So after the legislation was introduced again, we had immediately, on the same day, a City Council member briefing on hepatitis B in New York City. And the purpose was to educate the council members and the staff on the importance of hepatitis B and in their communities that they serve. We had an overview of what hepatitis B is and the impact of hepatitis B in the different communities. So we had a representative from the Chinese community, the African immigrant community, the Korean American community, and the Hispanic community. We also had a personal story shared and then a national perspective. It was a really important event. We had key council members in attendance. We had also key council members who sponsored the event. This was just the right time for this legislation to come through because Corey Johnson had just been elected in the last year. He was the chairperson of the Committee on Health, and he is also HIV positive. So he came with a perspective of really understanding the struggles of a lifelong disease like hepatitis B. Next page. So after the member briefing in May 2014, we had a hepatitis testing day press conference. We gathered together hepatitis B and C advocates to raise awareness for hepatitis B and C testing, prevention, and treatment. At these events we hold annually, we always invite local and ethnic media. We really just try to show the solidarity between the two advocacy groups, and then also to keep the topic in the press. Next page. So then June 2014, we had a public hearing on hepatitis B and C, and physicians, organization leaders, advocates were encouraged to testify to the needs of people living with hepatitis B and C, and then to share their perspectives on what was needed to improve awareness, screening, and linkage to care and treatment in New York City. They had representatives from the Department of Health, they had representatives from different hospitals, NYU, Charles B. Wong, and it was important for the Committee on Health to really understand why we were asking for this legislation and what impact it would have, and the seriousness of the disease in the community. If you'd like to see the agenda or the actual video of it, you can go to the link at the bottom of the slide. Next slide. So then in July, we had the first ever New York City Hepatitis B Awareness Week. We had a whole week long of events. We had Margaret Chen draft up a proclamation. We had city council members, Department of Health in attendance at the kickoff press conference. And then following up, we had educational seminar, a documentary screening, and a sit-in to build awareness in the community. Next slide. So that Hep B Awareness Week culminated in the World Hepatitis Day event, where we had an awareness campaign around the different 5 boroughs, and we ended with a freeze mob centrally located in downtown. And we had, again, local and ethnic media there. We had a city council. We had Margaret Chen in attendance. Really, it's important to have these events. We had this World Hepatitis Day just happens to fall into the summer, and you have a lot of college students and high school students wanting to get involved, and so that's why we're able to get such a large showing. And I think the media really likes to see that kind of civic engagement by the youth. Next slide. So then in February 2015, we had a New York City Hepatitis B and C Awareness Legislative Breakfast. At this point, after the hearing, things were going in the direction that this legislation was going to get enacted into law. And so there was already negotiations between the New York City Department of Health and the different organizations as to what they would want this annual report to look like and what was actually feasible with the information that they could collect. So we had an early success at the legislative breakfast. The Department of Health released the 2014 annual report. If you'd like to see it, there is a link at the bottom. But at this event, we had different representatives from local hepatitis organizations speak to their programs, speak to the importance. We had city council members, Department of Health staff, and then patient and provider testimony. Next slide. So I guess to really summarize the points and the keys to success is to have that hepatitis B champion on city council. I mean, without Margaret Chen continuing to present that legislation, to show up at all the events, she's been dedicated and a strong advocate and champion. But I think it helps, though, too, to entice that champion by having some sort of legislation or proclamation for the champion to support. Also, as you can see from the timeline, having multiple press opportunities for the champion to participate also keeps them engaged, and it keeps that topic or that issue in the front of their mind. I got to know Margaret Chen's press secretary very well, so I was always planning and scheduling events around the council members' schedule, making sure that they can attend, and also being able to find different opportunities, because the press secretary usually has some greater connections with the local and ethnic media that maybe your organization or yourself don't have access to. So in conclusion, just keep the momentum going. And that's it.
Great. Thanks so much, Nikki. Those were really insightful experiences from New York City, your time in New York City. So we now have lots of time for questions and answers, or questions. So we'll go ahead and take your questions now, and if you have any, please feel free to type them into the question box, the chat box at the bottom of your screen. And we'll begin the Q&A portion. All right, so we have a couple of questions for Nikki. So you had mentioned Margaret Chen a lot as your council champion. How did you recruit this champion and persuade her to take on your cause?
Sure. So because Margaret Chen is Charles B. Wong Community Health Center is located in Margaret Chen's district, we had an outstanding annual, if not more often, check-in meeting with her and her staff, just to kind of let her know what's going on in the health center and what's going on with her constituency. And in those meetings, it became clear to her that hepatitis B just kept coming up and was such a big issue for Asian Americans. So she really felt that if she didn't do something or say something, that it wasn't going to happen. So she after hearing the presentation, like as Isha has talked about, what to say, or in your brief meeting with policymakers staff, she really was inspired to take action.
Great. And you had also mentioned a lot of work with her press secretary and the importance of inviting local ethnic media to a lot of the advocacy events. Did you reach out on that? What kind of success did you have with mainstream media showing interest?
Sure. We always send press releases to both ethnic and mainstream media, but success rate with mainstream media has been minimal. But towards the end, we did get a lot of interest from the local news channel New York One, and then some of the local newspapers.
Okay, great.
I think it's just about persistency.
Yeah. And then, Isha, you had mentioned stress the importance of keeping an eye on local or state budget cycles in order to submit, I guess, funding requests or opportunities for funding to your programs. What other examples would you recommend in addition to funding? Or have you seen any other examples in terms of what to advocate for at the local or state level? What types of issues related to hepatitis B?
Right. So I think that besides funding, when Nikki was talking about proclamations, that's really helpful to work with a champion to write a proclamation, because then it will let more policymakers know about the importance of Hep B. If you are able to build a strong champion, you can work on legislation with them too. And there are some examples of state legislation that has been dedicated towards Hep B or Hep C services. There is one example in Illinois, and then Nikki brought that example in terms of reporting in New York City too. So those are ways that you can reach out to your policymaker. But I really stress in my presentation, I was really stressing the site visit. Building those personal connections with your policymaker is incredibly important, and having a site visit allows your policymaker to see how things work within your organization or coalition and what you're actually talking about. So that makes an incredible
So this is Nikki. I guess as far as the specific example I gave for New York, there was also a significant funding allocation made at the same time, and I think from that reporting to the Department of Health and then the City Council about the progress that those programs are making, and that they're seeing the impact in the statistics, is really important, just for that to be continued to be supported. But it is difficult. It's difficult, I think, to keep the momentum of the events and the press conferences and stuff, especially with such great staff turnover. So sometimes it does fall in the programs speaking for themselves.
Right. And Isha, did you want to add anything?
Yes, only to piggyback on Nikki's response, to try to figure out a way to evaluate, because they really go by statistics, as Nikki mentioned. So if you can figure out a way to evaluate your program and its success, not only anecdotally but quantitatively too, that's very helpful for them.
Okay, thank you. All right, and then this is also a question for Nikki and Isha. Feel free to chime in. From your experience, what other partners or types of partners were helpful or necessary to move your advocacy forward, in addition to, for example, the City Council?
So I think when I spoke to the member briefing, I think what was really exciting about that event and the coverage of it is that it was multiple communities expressing how hepatitis B affects the Chinese community, the African immigrant community, the Korean community, the Hispanic community. I think it was very surprising to a lot of City Council member staff that this isn't just about Asian Americans, and it can relate to their districts that they're serving. I mean, what's also really important to them, and Anisha spoke to this too, about statistics really being targeted to that specific council member, that specific policymaker. And then I think other supporters of larger organizations, having the Hep C advocates also helping and providing a loud voice was also really beneficial.
Okay. Great.
I think that,
and then,
oh
sorry, Isha, go ahead.
Kate. I was just going to say, just really, along with what Nikki had said, just really trying to connect hepatitis to liver cancer. That's, you can build those relationships with other advocacy groups that way too. And there is a lot of benefit. Of course, this is, of course it is, there's a lot of benefit when there are more players, or you can show the impact on so many different communities. So the more alliances that you build and show the impact on other communities as well, the better, the easier it is for you. So connecting that to liver cancer or cancer as well is helpful in advocacy.
Yeah, that's a great point. All right. So I wanted to, Isha, I wanted to ask you, and Nikki, feel free to chime in, is what are some of the issues at the national level that may affect state or local hepatitis advocacy work that folks should know about at this time or be on the lookout for?
So one big thing that we found out about today is that for, as many of you know, we've been working on this site to make sure that hepatitis B screening has been covered first in the health insurance marketplaces and then in Medicare, and we found out today that the national coverage determination was finalized for Medicare. So those who have Medicare will be able to get Hep B screening at no cost. So that is a huge victory. And so what that means that's something that you could find out within your state. We have a guide within Hep B United of most Hep B United states and where they are with their preventive service coverage, which we are going to update. But that's something that you can keep a lookout for and approach your policymakers about. And you can feel free to reach out to me after the webinar if you have any questions about me to answer them.
Great.
So that
sounds like there will be opportunities there.
Yeah, absolutely. Yeah, and I think one other big thing that we need to continue to discuss is the fact that we don't have a national surveillance system for Hep B and Hep C, and so talking about local stats within your local and state jurisdictions is really important, and to have that granular data, particularly by race and ethnicity, and also looking at specific data collection mechanisms. Like, the more accurate we can have that data on the local level, the better it is, and then we could make the case nationally too. So it's kind of, we're working together to make sure that we have a more robust surveillance system.
Great, thank you.
Sure.
And then we'll see if there are any other final questions for either Nikki or Isha. Okay, so Nikki or Isha, did you have any final comments you wanted to make to the group before we wrap up?
This is Isha. I just want to thank you all for the opportunity to present some strategies, and feel free to reach out if you have any questions or want to know about other models that exist nationally, besides NICI's, of course, which is a great model in New York City. And yeah, thanks.
Thank you.
And I do want to just say thank you. And I think, you know, if anyone wants to reach out and hear more about those different types of events, I'm happy to help. But I think it's an exciting time for hepatitis B advocacy.
Yes, it certainly is. And we're really glad to be able to present today's webinar. And I wanted to thank you both, Nikki and Isha, for your time. And I wanted to thank everyone for participating. And a lot of the issues that were mentioned on the webinar today are available via fact sheets that you can use in either your local advocacy initiatives or in your meetings with your Congress person in district, and they're available at the link there on your screen. And they are updated up to 2016 and new, so please do share them widely with your networks. And also, finally, if you have any further follow-up questions, our contact information is there. Feel free to email us directly, as Isha mentioned. And the Hepatitis B Foundation, after today's webinar, we will include the handouts that Isha mentioned, as well as a copy of the presentations and a recording for you to share with others today. Thank you again, and please do fill out a short survey as you exit the session, and have a great day. Thanks all.